With the loss of estrogen, our body starts to have a variety of different symptoms: hot flashes and night sweats, loss of libido, fatigue, vaginal dryness. Eventually, sooner or later, it will happen to all females who are having menstrual periods. Hi everyone, I'm Dr. Jennifer over here at Northwest Integrative Medicine. Perimenopause is a point in a woman's life where she starts to produce less estrogen. Before I go into that, I want to let you know that I will be using terms male and female, man and woman, because right now that is how the medical research refers to patients where the studies have been conducted. It's in preparation for her body stopping having menstrual cycles. So it's a time where many different things can happen, and it can happen at a variety of ages. Eventually, sooner or later, it will happen to all females who are having menstrual periods. What is actually happening is that the body is starting to produce less estrogen. Along with that, the body is starting to produce less progesterone and sometimes a little testosterone as well. The ovaries, which are responsible for producing these hormones, as well as dropping our eggs every month in the hopes that, or the potential that we could become pregnant, this process is starting to come to an end. With the loss of estrogen, our body starts to have a variety of different symptoms, if we have any at all. These symptoms can include hot flashes and night sweats. We can have a loss of libido. We can have fatigue. We can have vaginal dryness. We can have skin dryness. If the estrogen gets to be low enough, we can actually feel like we have extreme fatigue or joint pain. In fact, having low enough estrogen or no estrogen at all can feel like having the flu. There are a variety of other symptoms that can happen, but these are the main ones that I hear most of all from my patients. During perimenopause, one thing that happens almost across the board, if you are having regular menses and you don't have an IUD that prevents your menses, what often happens is that they start to become erratic and irregular. They can become farther apart. They can become closer together. You can have longer menses than you had before, or they can become shorter. Most of this is a normal process, and I would say you don't necessarily have to go see a doctor about it unless your menstrual cycles become less than 21 days long. Anything that's longer than that, it is a part of the natural process. If you are starting to become curious about whether or not you're going through menopause, there are some tests that can be run. We can check your estrogen and your progesterone, even your testosterone. For most women that I see in the clinic, it starts happening in their 40s. However, it can happen anytime between the mid-30s and in the mid-50s. Most of the people I see are within at some point during their mid to late 40s. If you have any questions about perimenopause, if you think you might be going through it, if you know you're going through it and you can't stand it, give us a call here at Northwest Integrative Medicine or look us up online. I'd be happy to talk to you about it. Thanks.